Welcome, everybody. We're going to start. For those of you joining online, thank you for your patience. Just some last-minute technical difficulties. Welcome to the first co-sponsored Merit CERC rounds. I'm Jonathan Sherbino. I'm an emergency physician here at St. Joe's, but I'm also the Assistant Dean for the McMaster Education Research Innovation Theory, that's a mouthful, Merit Center. We're really pleased to be partnering with the St. Joe's Emergency or Education Research Center, so CERC, for our co-sponsored monthly rounds. I'm going to introduce Dr. Ganji in a second to speak a little bit more about CERC and this initiative. But I think it's appropriate as we contemplate the idea of healthcare leadership and the scholarship around it, that we think about the bigger context in which we are learning and discussing and the leadership roles that we have, particularly as we acknowledge that this is the traditional territory of the Haudenosaunee and the Anishinaabe nations. This land is governed by the Wampum Agreement, the dish with one spoon. And I think as we reflect about what does it mean to be a leader, what does equity look like in our context, and particularly when we hear from the founding dean, Dean Chan, around the mandate for the Toronto Metropolitan University's role in developing a new way of thinking and moving forward medical education. I think these ideas of leadership in the nations that have traditionally been a part of this community are important to consider. I'm going to welcome Azim Ganji to say a few more words before we introduce Dr. Chan.
Thanks, Jonathan, and thank you all for joining in here. So it's really a great pleasure, and really I'm super excited to celebrate this wonderful collaboration between the St. Joseph's Education and Research Center, or CERC, and Merit. And I really believe this partnership is really signifies a lot of commitment to excellence in education, research, and innovation. And I'm really hoping that this will yield significant benefits for our learners, our faculty, and the education committee broadly. The aim of the collaboration when Jonathan and I met was really to leverage our collective expertise and our resources, really to advance research and knowledge in education, and really try to promote further interdisciplinary collaboration and other healthcare professional involvement, as well as ensuring that we're meeting the principles of EDI in our work. On a side, today is really a true privilege to extend a really warm welcome to Teresa Chan, the founding dean of the Toronto Metropolitan University School of Medicine. And we all know Teresa well and the tremendous work that she's done. I know she brings an immense amount of experience and passion for education and dedication to excellence, and really will be a wonderful leader with her visionary and her. I'm sure she'll propel TMU to different heights, and we really look forward to working with you, Teresa, as a collaborator. So thank you all of you again for joining us either in person or via Zoom. Now I'll hand it back over to Jonathan.
We're going to have an opportunity for questions virtually, but also in person. But let's begin a bit of background for those of you who don't know who Dean Chan is. She is from McMaster, and I think we take a lot of pride in there. She's done her residency training, and she continues to have connections and associations with us here, continuing as an education scientist with Merit, and also as an associate clinical professor in the Department of Medicine. I'm very delighted. She is a good friend. I've been able to see the incredible things that she has done as a scholar, the incredible things she continues to do as a leader. And she is OG. She is the founding dean of the first medical school to be opened in Ontario in more than 2 decades. How incredible an opportunity to put a big kick in the universe, a big dent there, and to say, maybe we can do things in a different and more transformative way. Dean Chan.
Okay, thanks everyone for being here, and thanks to the 38 souls that are online, although I think we're double counting one of them because Sam's at the back there tuned in, I'm sure. Thank you very much to Samantha for organizing me, for Jonathan for calling me twice and texting me just to make sure I knew where I was going, and to Azim for the warm welcome. So I really appreciate everyone for all that you've given me in the past, and hopefully I can take that to help with changing things for the future. Today I am pleased to kind of speak to some of the scientific work I've been working on in the last 2-ish years, really looking at how we can explore the scholarly and healthcare leadership landscape and how we can reflect on the past, move towards the president and think about how we can affect the future. And so I wanted to make sure that I gave my own land acknowledgement as well. I think for me, this is particularly salient because I've been doing a lot of reading around this whole region, because we had to recently reinvigorate, let's say, the land acknowledgement that was written for Brampton. And so I've been doing a lot of my own learning around this. And I would like to say that, I'd encourage all of us to take that moment to recognize and acknowledge that we are located on the traditional territories of the Haudenosaunee and Anishinaabe nations. This territory, covered by the Upper Canada Treaties, is within the lands protected by the Dish with One Spoon Wampum Agreement and is directly adjacent to the Haldimand Treaty Territory. Now in Brampton, there is a larger catchment. However, we are still within that Dish with One Spoon Wampum Agreement. And really, we're encouraged to think about also the 2 Wampum Agreement, where we're trying to understand how people can move forward together in parallel, respecting each other's ways of doing, being, and knowing. So I think that as we head into a new territory where we have McMaster and U of T and McMaster and TMU in the middle, how we can work on really honoring the 2 Wampum Agreement and thinking about how we can continue to live to the Dish with One Spoon spirit of how we can be sustainable, collaborative, and take only really what we need and parlay that into the future so we can be sustainable across the board. I have my obligatory conflicts of interest slide. I am very lucky to have received some grants from most recently Novo Nordisk, but also from the OCFP, TMU, McMaster, WMC, the Royal College, and PSI Foundation and the Medical Council of Canada for some of the work that I do. Oh, and particularly some of the scientific work that will stem from this, but aren't actually tied to this particularly, would be our work with the MyTax granting organization. And so by the end of the presentation, I want participants that are listening to try to see if you can articulate the key elements when constructing an academic leadership ecosystem, to think about at least one new conceptual framework or academic healthcare leadership theory that might help you rethink the way that you do things, and to brainstorm ideas on how you can engage in personal leadership development within your own environment. So I think the context of healthcare leadership education in Canada is diverse. I think that there's different ways that people come to understand how to become a leader. Some people do it through the school of hard knocks, not showing up to a business group meeting, everyone voting you in as chair or lead, being the last person to look up when everyone else is stepping back from the line, and also in the time of the pandemic, stepping up to the plate. Right? We've had many people who have become phenomenal leaders because they saw that it was go time and that we needed to light up the world, we needed to conquer COVID, and we needed to really engage in how we could lead differently, be differently, and actually shape the system differently. And so, yes, there's a little bit of the last person to say not it, but I think increasingly, many of our leaping into opportunities to be able to think about how we could lead in different avenues, whether that is renovating a curriculum or stepping up to think about a new protocol or being a leader of a physician group or being the manager of a nursing unit. I do think that each one of these frames brings with it different context. And I think that healthcare leadership has definitely inextricably changed in the post-COVID era. And healthcare itself is increasingly complex, right? The pandemic has had real impacts. The realization of the speed of healthcare used to be that we were one of the more conservative groups that would take our time, think about all the protocols, be very thoughtful. And then COVID came and we're like, okay, we need to change everything overnight twice. And that's what we did. We were able to do that. And sure, there's a lot of change fatigue that's happened because of that. But also, I think we realized how quickly we could make change if we needed to. And I think that that's something that we hopefully can take with us as we go forward in the world. Moreover, because of the pandemic, there's also been a lot of post-pandemic burnout. Many of us have been on those front lines, wearing those N95 masks, you know, wearing those yellow gowns that many of us use, changing gloves 32 times in a shift. And we know that all of that has hit us hard, both in our hearts and our minds. And some people are taking a step back from healthcare. Some people have retired altogether. Some people have rethought what kind of healthcare they want to engage in and how they want to go through this. So I really do think that post-pandemic burnout is real. And for I think the statistics are every 10 nurses that leave the field, we can replace them with 6. And so it is something that we are working on, and we need to step up to the plate to try to figure out new solutions to be able to do some of this. There's also been increased patient care complexity in the world because I think that we've been doing a good job. And when you do a good job, people who might have in decades past maybe not made it to age 50 now do make it to age 50. And so they have with them the burden of the disease that gets them to where they are. And sometimes that complexity of care is a badge of honor for many of us who get people to that ripe old age of, 80 with multiple comorbidities. But it also means that we have to know that they have the ripe old age of 80 with multiple comorbidities and what that means for the system and the impacts. And I think that there's been increased funding needs for various reasons alongside many other sectors. Inflation is real, and healthcare has not been immune from those costs. So I do think that healthcare itself is increasing in complexity. And so when you're thinking about that, it's important for us to think about how we can build capacity within healthcare and how that is an essential part of what we need to do in health professions education, in medical education, in really health systems, right? Because filling the void of a leader who retires after a long life of service, there should be some level of succession planning or other ways to be able to fill that void, whether it's like taking that job and splitting into 3 because they were white knuckling it for the last 3 decades and really should have been 3 people, or it could be that we need to reinvent the way we do team-based leadership, for instance. I think we need to be thinking about how we lead and build capacity. I think academic capacity in academic healthcare is even more important because we have a dual role. Not only do we have to engage in building capacity within our health systems, we also have to think about how we train the next generation, how we advance science, make sure there's innovation, and all of those things require capacity building and probably different skill sets and different styles of leadership, because each one of them is actually fundamentally different kind of leadership, right? Clinical leadership is very different from running a research center. I'm sure Jonathan can tell you that. He probably wants to do one and not the other, as evidenced by his career. Whereas his friends, some of them, Paul Miller, for instance, is very much clinical leadership, and he would not want to lead a research center by any means, although he's kind of leading one now with the paramedics. And then, like on the flip side, there are people that are tried and true innovators that will run off and do a startup or engage in different kinds of entrepreneurial ventures and be doing some of that other work outside of the environment. Maybe they're working with, the police board, for instance, to change the system in another sector altogether. And I do think that each one of these individuals has a different kind of need for their development, and also it'd be a pretty different phenotype that would actually engage in that academic development, and the pathway might be quite unique. And so what systems and structures do we need to support our academic clinicians to flourish in the modern academic health sciences center? That is a question that I've been exploring for a little while, and I thought, now that I've given you the background, you can come with me on a tour of some of the work that we've done. And so traditionally in academic healthcare, the focus is often the individual student, the individual teacher, the individual within the system. And yet, I think outside of AHSCs, often the individual is not just part of oh, interesting. I think I'm still running on Zoom. So I don't know how we're gonna fix this. Sorry, Zoom folks. Somehow the screen has decided that it was shut down. But I can still talk on this slide. If you can remember what the slide was, it said individual, ecosystem, and outcomes. And so the idea would be that outside of AHSCs, there is some literature that includes the work of an author named Slowick, who really, really kind of outlined what it was that introduced their group into thinking about the ecosystem around academia writ large and how it could affect outcomes. And so if you can, for the people in the room, the slides are on the screen off to the side, so you can see it. And really, it's going to take that light bulb a little bit of time to burn brightly. So I'll just keep waxing philosophical here as I explain that really when it comes to it, the individual is only one component of a much bigger ecosystem. And it's that ecosystem that actually results in the outcomes. For those of you who are aware of something called the realist evaluation framework, it's kind of the idea of the context, the mechanism, and the outcome. It really overlaps this very nicely because the context and mechanisms are what's in the ecosystem, and an individual is thrust through that ecosystem to experience different contexts, different mechanisms, and then that results in the outcomes. So I do think that this really resonated with me. And for those of you who are reading at home along at home, you can actually scan this QR code and you'll be taken to this paper, so you can read it for yourself. And this paper really talks about the academic ecosystem in higher education more broadly, and not just specifically within health sciences centers. And so my question really was, how might we leverage that ecosystem in terms of development? And so how might we actually help change the context and the mechanisms within the ecosystem, maybe grow some trees, maybe put some, belay ropes around the climbing wall, maybe make a canopy driven, what are those zip lines across two very tall trees to make it have reality. I think that we can affect those things within our ecosystem to build something more tactically, rather than necessarily have it be something that is accidental. Although nature is grand, and there are many paths that are walked because they are the convenient way to walk, I do think that architecture and design in developing that academic ecosystem allows us to make it flourish more. And so this was some conceptual work that I embarked on with Ruth Chen, who hopefully is tuning in online, although I can't see for sure, but she can watch the recording later, and Rich Winters and Sarah Lal, who helped me think through this in a commentary. And I'm going to take you through kind of like how the Slowick model and how it interfaces with some of the things we were thinking about. And so when you go through the forest, this is hopefully a vantage point that you could have, really obviously great ecosystem where there's lots of shrubbery and tall trees and then spaces in between. And you do have a little bit of everything at different layers, right? And so when you're constructing the academic ecosystem, what we wanted to do was saying, many of us need to take a walk through the path of that ecosystem, and hopefully we'll learn something. And so for many of us, that begins with that identity formation as seeing ourselves as a leader. And so there's different kind of literature on professional identity formation. I won't go into that. You can listen to Jonathan's podcast about that, because last week they dropped a pretty good episode on this. But for those of you who are interested, there's lots of people that talk about professional identity formation, but specifically this is the identity formation about being a leader. So you may have a professional identity. This is layering on top often, because you're not just an academic, you're an academic leader. You're not just a nurse, you're a nursing leader. You're not just a physician, you're you're a physician leader, right? These are the ideas, is that you may already have another identity and you have to set that aside or change it as you evolve your perception of yourself as a leader. I think for that, to get someone into that zone, it might be exploratory one-off sessions like free webinars or podcasts or videos. It might be nominations for a leadership learning program. So I know that at McMaster, for instance, there's the academic leadership program that is by nomination by some of our leaders in the ecosystem, because we know that some people need to be tapped on the shoulder to realize, whoa, you mean I could be a leader? And that's really important, right? Okay, and now we have mood lighting, which is amazing. All right. Hello to those people online. Now it's a different kind of lighting. It's because it's getting more somber.
It is.
Okay. And so I think from here, we know that for some people, once they've got that identity, they'll go into being engaging as a leader. So they'll take that first role, they'll take that first leap. see themselves as a leader. And often then they'll be a leader with some followers, maybe just one follower as I depicted here, but they're going to go on that trek. They're not just going to stand at the edge of the ecosystem, deciding whether or not they're going to go in. They're going to actually start walking the walk. And I think you do this through early leadership opportunities. You make sure that you give people a chance to lead initiatives, be an assistant program director, be a clerkship director, shadow others, be mentored by others, have the chance to apprentice as someone within an office, for instance, and be an associate director, for instance, or something like that. And I think that engaging in that leadership, having those early leadership opportunities is really crucial. And then I think you have to achieve as a leader, right? So you don't just see yourself as a leader. I think you have to have some track record of getting some feedback about how you've done things right, wrong, or could do better. But you have to have some level of achievement, right? Because for many people, they might engage in leadership, it goes horribly, and then they exit out of the forest and out of the ecosystem. But I think that as you achieve things as a leader, as you have those early wins, it is possible for you to start seeing yourself as a leader with a track record. I think that means role clarity for new leaders. It means effective onboarding. It means that we have to continue to mentor and sponsor these individuals as they enter into that role. And then I think we have to develop coalitions. We have to make sure people feel supported in the leadership work that they do, and that we need to think about how we could actually foster them. And so that means helping leaders feel like their work is valued to the institution, that is meaningful to others, and we need to show them that. So sometimes that's through commendations, sometimes that's through just an email to your leader, because they probably don't get any good feedback. They probably only get the complaints. So if you get a chance after this session, I would challenge you to write a really nice email to your leader for something that you think they did really well recently, because most of the time it's not the great news that rolls up. It's usually just the bad news. And so I think it's important, if you get a chance, to be thankful and grateful to those above you, and to make sure that they know that you see them. And I think we have to then create systems. We have to look back at the entire trek and say, hey, could that have been an easier trek to get to this point? And is it possible for us to make a better ecosystem that's more well developed, that has better paths, clearer lighting, more, what's that stuff that you put on the ground, gravel or mulch, right? So that other people can walk easier. Maybe it's about paving things, or maybe even just walking the path over and over again so that people can see the way. And so you can go from that wild open forest to something that's a little bit more like this, with lots of mulch and trees, but you can still see a path forward. It can be easy for others to walk behind you. And this is, I think, how we actually create an ecosystem that allows for that succession planning and that process. And so this is an example of the analogy that I would walk through to say, how might we take, really essentially the LEADS framework, that's a framework in Canada. I kind of went through the LEADS, but the idea would be, you have to see yourself as a leader. You have to lead yourself. You have to engage others. You have to achieve results. You have to develop coalitions, and you have to think about the systems transformation as a leader. And I think that to build an academic ecosystem, it's actually a lot of the same principles, just applied slightly differently. And so that's kind of where we're at. And we can construct the academic ecosystem if we want, where lots of people can play. Because I think historically, leadership has been closely held by certain people that knew the path to the forest. Maybe they found the breadcrumbs that Hansel and Gretel laid down and were able to find their way to where they needed to go. But maybe, just maybe, as some of us walk through the forest, not only do we put down breadcrumbs, which may not be there because they'll blow away or get eaten, maybe we could actually put down mulch and flatten some of the terrain so that it's easier for other people to walk behind us. And I think that's what I would challenge us to think about in terms of the academic leadership ecosystem. So if you want to read more about this, you can scan this QR code and be taken to the paper. Obviously, the recording will have this later as well. But I think that it just kind of goes through some of the essential steps we think that are important for developing that academic leadership ecosystem, and it overlaps quite nicely with the things that we've talked about here. And so traditionally healthcare, the other thing that we have to think about is that in academic healthcare, we actually get to pick. Do we go with the red pill or the blue pill, right? Do we go left or right? Do we go academic or clinical? And some people waltz seamlessly between those two, right? There's some people here in this room right now that I'll give shout outs to that have been both people that do academic work, but they are also clinical leaders. And I think that that's amazing because you've found the secret sauce, which is that when you know how to lead a group of people, you can actually parlay that same leadership skill back and forth. Some of us, however, might have more specific needs or wants and desires to flesh out one strategy or the other. And so some of us might pick more of a track, but most of us in academic healthcare will often have dual roles. Now, whether that is clinician and academic, or mom and academic, or community organizer and clinician, or so on and so forth, many of us will have multiple identities that we're fleshing out at the same time. So knowing that we have that, wanted to go into the idea of considering that complexity and that duality within academic health sciences centers. And so shout out to Sarah Law and Sandra Ramelli, who are co-first authors. And so depending on the day, I put one of them in first author, but I believe that the paper is actually under Ramelli as the first author technically, but they are asterisk co-first author around the leads plus developmental model. And so I'll take you through kind of how we did this. Because a lot of the time in most of the world, we would see academia and hospitals as separate entities. But I think in academic health sciences centers, that's when the overlap, where we have our academic work and our hospital work, and in those zones, we sometimes overlap. And so what is that developmental model for leaders in the health academic health sciences centers? Because we know that that single individual may actually have a duality that they have to navigate. And how do they coalesce those roles? How do they see either those things as distinct or the same? And so this is, I would say, conceptual plus stakeholder engagement. And so I'll kind of go through the methodology of it in a little bit, but the idea, just I'll put a peg in that to kind of come back to it. Because this is the infographic we had to create in order to actually explain our methods. So I will kind of explain that it was an integrative review where we had 4 stages. And what we did was we actually generated an initial model based on our understanding of this literature, our discussions about leadership, the LEADS framework, and then also some other things. We then did some prototyping, iterating of the model where we used personas to actually test this, with exemplar, classic kind of people that were fictional to really see could this test, could we find things that would resonate with people that would be the elements that we wanted to do. And then we thought about then how we could refine that model with further discussions within our team. Then we did actually invite consulting knowledge users to engage in videos and vignettes around the story, and in order to really think through how we might actually engage in this kind of work. So I'm just gonna think there's some kind of sound going on. Okay. And ultimately, I think that we then also did some interviews with knowledge users to be able to figure out how we would actually activate this knowledge, how what would be useful to them as either educators or leaders or scholars. And we consulted them. So kind of like what Oxy and O'Malley kind of proposed as their 6th step of their scoping review, we took what we found and we developed, and we asked people for their consultation to see, what do you think about this? And actually got some really robust feedback that we could fold into this model. And then the 4th phase is refining that model based on the knowledge user feedback to be able to understand, what did people say in their interviews? What did people say in their feedback in the surveys? And then how could we refine the model some more? And so in phase 1, that's exactly what we did. We had a team, a coalition of folks that had, one was Graham Dixon, who actually was one of the founders of the actual LEADS framework. So it was really nice to work with him on this project. Jonathan was one of the others, and then Sandra and Sarah were both also on the team with us. And so we thought about all the literature that we knew about with the leadership frameworks, and then we thought there seems not to be a great framework that really allows us to understand that duality that exists within AHSC. So we're like, is there something that we could bring in from other places? And so that's where we threw something together, and then we tested it against with these vignettes to prototype against individual experiences from our memory banks to develop some prototypes to see if those vignettes and those personas could interface, and could we explain it? Does it resonate? And so though we didn't map it to individual people in the paper, we were trying to think of, in our memory, could we see how there were structures that were analogous, and the people that could have had the similar experience, where there's people in our mind's eye that fit our model. And then we refined it some more. And then in the next, this is basically what we came up with, was kind of 4 people that we thought, Beth, the payroll specialist, June, the pain clinic manager, Pravinder, who was a strategy specialist and also is in his spare time, a university professor, and then Mary, who is the VP of strategic partnerships and also a university professor. So it was really bridging both of those roles. And so we then took what we had prototyped together to turn into a little narrated video, and then we asked people to give us feedback. The survey was emailed, and people who met the inclusion criteria were included. And then we actually asked them if they wanted to even talk to us more and give us deeper insights. And many of them actually stood up to do that. And so in that 4th phase, we took all the analysis from that to really revise that model some more, and then allowed us to then really kind of think through how we would actually put that out there into the world. And so the way that we came about the Leads Plus framework was that we had the Leads framework, which we all know and loved, and thought that was a really good framework for healthcare leadership. However, in the Academic Health Sciences Center, we wanted to find another framework that might complement this one. And so we actually found this model, Keegan's Orders of Consciousness, where there are 2 kind of like levels that are below this. So there is a first and second order, but those are usually for small children, like my nephews, who go through those early developmental stages. But then by the time most of us are in our teenage years and beyond, we're at the 3rd interpersonal kind of level, institutional level, and interinstitutional level at 5th order of consciousness, where we kind of understand the world differently. So interpersonal is where you see yourself in the socialized kind of world where you exist. Institutional is where you might see yourself as part of someone within an institution. And then the interinstitutional is where you start to see the patterns and be able to bridge multiple institutions in multiple contexts. So we thought that's kind of interesting, because that multiple worlds kind of view is really something that we wanted to bring in. So we thought, what if we could do a theoretical remix? And so the idea would be just like, artist jam. Like, I think there's some room for us to be a little bit more playful in the way that we think about theories in MedEd. And so many of us talk about conceptual frameworks or theoretical frameworks. I think they come from somewhere, but I think that just like Beyonce, like you can sample, right? And I think that that this is our kick at the can of doing some of that theoretical remixing to say, how could the Leads framework interface with Keegan's Orders of Consciousness? Because it has those 2 things. And so what we did was we made a grid. It's not as fancy as like sampling for a Beyonce song. But the idea would be, could we have the Leads framework interface with some of the orders of consciousness, and would that reveal something new? And lo and behold, it kind of started to emerge as something that we could see, right? And so you could imagine the 4 phenotypes that we had were, essential followership. Like, so if you were going through your world and you were doing your job, doing it well, exactly the way that your job description has, you're being an essential cog in a really, really important process. And so if you are the payroll specialist and you don't do your job, guess what? People will get paid. So you're crucial, and you need to do it well, and you need to do it highly reproducible, and you focus on that task and you do it great, right? And so that followership is so essential. And many of us, depending on the circle that we run in, we probably have to do this once or twice a day, right? So I know that, for instance, my husband Bruce sometimes is an essential follower when it's time to take out the groceries from the car. I take 2 bags, he takes 2 bags, and he follows my lead. And that is essential followership, and it's awesome, right? But I think that within our organizations, we have that too, right? Strategic followership is where you might see yourself within that bigger framework, and you see yourself as interdependent, and you need to fit in and align your team values, but you know that there's a bigger, higher mission for your organization, and you want to see how your piece of the world, your work could align, right? And I think that's strategic follow-up here, where you understand the strategy and you follow along in your way, but you aren't really making the strategic calls. You're not executing. So you're executing on the vision. You're not actually creating the vision. I think then for some of us, you are a role-based leader where you get a title and you're an associate director or you're the chair or you're doing something in that role. And so again, back to that job description, you try to make sure that you hit all of those things and make sure that you figure out how you can support your team and you look at your team. And then you need to think about complexity-based leadership where you might have multiple identities and you might be one thing on, to be honest, in a given hour, you may be different people to different groups. And in fact, in one Zoom, you may have some people that relate to you one way and others that relate to you another. And so there is this complexity that has to come into play when you have multiple identities, right? So there have been multiple times when I've been in a Zoom, let's say with our, my current department chair still, Mark Crowther. Sometimes I was his peer on a Zoom, and sometimes I was, someone that was in his department, and sometimes he was a client that was serving as the associate dean of CPT, right? So depending on the situation, we might have different relationships even in the same hour. And so it's very interesting when you have some of that. And I think that that complexity-based leadership really coaches us to think about how we help others see themselves as leaders, but also that coaching that win-win condition so that your multiple identities can reconcile with each other and that you're not actually causing any kind of win-lose condition because you hold multiple roles yourself. You don't want yourself to lose and win in another circumstance. You kind of want to see how you can bring everyone together into a win-win. And I think what we coined in our conceptual remix is to think about how the leads plus leader is someone who demonstrates that versatility, right? One moment you might be the dean, another moment you might be someone that's just in a leadership course, co-teaching with a colleague. In another moment, you might be someone who is seeking advice from someone who has walked the path that you have before, right? And so you can flex up and down and sometimes just be a very essential follower if that's the role that you need to have in the moment, and that you don't always have to be the leader in every way in every moment of every day, because that's also exhausting. Sometimes you just want to follow the lead, and sometimes you just want your husband to pick what we're going to have for dinner. Because, and I think that that's one of those things that you can follow along, right? And so I think this is where understanding that articulation is important to acknowledge. And so our results were that we had about 65 knowledge users approached by the email, with 29 of those, pretty good response rate, right? About half almost. And many of them thought that there was a high level of endorsement, 10 being the highest level endorsement. We're sitting around an 8 plus minus like 1.7. And some critiques of the model were that it felt very complex. And so we figured maybe we could fix that by developing some figures and some diagrams, and that seemed to solve that problem. Some felt that there was a little bit of a disconnect because some people had come from a world where they had less complexity, where, for instance, if they're a nurse, they picked a stream early on and then they didn't go back. And yet now we know modern nursing, I think increasingly there are clinical nurses who are clinician educators that are also QI experts in the hospital, also, leading initiatives, and they have multiple roles. So it might be that some of the national stakeholders are not in those contexts where they're starting to see the emergence of the people that want to do everything at once in their field. And so we fleshed out the vignettes to make sure that there wasn't just doctors that were listed in exactly what we were doing. And then I think that people were hesitant about the implicit hierarchy within the model. And so we redeveloped our model to be less hierarchical, that it wasn't like it wasn't that you had to accelerate or go up or down a chain, but rather to see it as a more holistic framework. And this is if you're interested in the kinds of knowledge users that we consulted. Many of them were clinicians, some of them were researchers, some of them were educators, some were academic leaders, some were senior executives at hospitals, and some were national organization leaders. And yes, that does total to more than 100% for those of you who are really good at math. But that's because many people, as you well know, had more than one role. And so that's kind of why some of them had 2 or 3 roles actually, which was interesting. And so this was redeveloped framework that we developed, and kudos to Sarah for wrestling with all the feedback and then coming back at us with this. But the idea would be we kind of like have the allegiance to the leads framework in the achieve results, transform systems, engage others, develop coalitions, right? We figured anyone that's on this map sees themselves sort of as a leader, or at least acknowledges that leadership is part of their life. And then from there, we wanted to acknowledge that as you move to the different zones, if you're trying to achieve results and engage others, you might be just really coming at it from the essential fellowship zone. However, if you're starting to go beyond your little unit and you're trying to develop coalitions, you'd be doing that strategic followership role. If you're engaging others to transform systems, then you're thinking more in a role-based leadership role. And then as you head into the wild complexity of multiple stakeholders, multiple competing demands, then you're develop coalitions while transforming systems, and you're really wrestling with that highly complex environment where you're going to be engaging in complexity-based leadership. And so that's kind of like where we kind of like settled on a really pretty diagram, I think, but also that it conveys what we were, and it wouldn't be where it is now if had we not had the feedback from our stakeholders. So we're very indebted to them for their rounds and rounds of feedback to be able to make our concepts better. And so the bottom line is that we think we created a useful framework that's grounded in theory and endorsed by knowledge users. It was kind of a novel use of integrative review that solicits feedback and engages the knowledge user feedback to be able to refine the model. We anticipate that this could be useful as a framework for coaches and mentors and for curricular design. And next steps would be empirical validation. And so we're doing a scoping review right now to use the literature on the leadership journey to map to the leads and leads plus frameworks to see if they exactly exist in the literature. And lo and behold, spoiler alert, they do. So stay tuned for that. I'll have to come back another time. And so this is the early unpublished work that I'm giving you a sneak peek for, but we haven't actually published this yet. So this is the first time we're going to be presenting some of it. We'll be presenting it at some conferences in the future as well. And shout out to Alex Illich, who is our second author of the scoping review, and she is going to present that at the Health Research Health Research Evidence and Impact HEI Research Day in a couple of months. And so what we try to do is use the existing literature around the leadership journey, which was a domain that we wanted to explore. And we use methods inspired by both Arxie O'Malley, but also we folded in PRISMA SCR, which is the PRISMA kind of guidelines for scoping reviews. And we also brought in Levesque to influence kind of like how we set up our point of view on this particular scoping review. We then also use a whole bunch of different databases, as you see there. And we're also doing a gray literature search just to augment some of this, because we know that a lot of the leadership journey writing is maybe in curricular design or other things that aren't in the published literature. And then we looked at the LEADS framework, the LEADS Plus framework, and the Koch-Bordage and Schmidt framework on scholarship. And so again, we kind of used both of these frameworks. And so we, after we sorted through all of the titles and abstracts, as you do with the scoping review, we analyzed all those full texts to see which elements of the LEADS framework or the LEADS Plus framework emerged in the literature. And so we had a lot of titles, just shy of 4,200 titles, and we got it down to 125 full text articles for review. And specifically, we wanted to make sure that we looked at the LEADS and LEADS Plus frameworks. And so we did find that the competencies for the LEADS framework showed up pretty evenly, with a little bit more emphasis on leading self, because it is the entry point into leadership. And within the LEADS Plus framework, we did find that role-based leadership, complexity-based leadership were more prominent, and there was less, generally speaking, on followership, and less on that versatility and adaptation of moving between the roles that was featured in the literature, although it did make an appearance. And so this is kind of a plot of like just raw counts of out of the 125 articles, how many mentions of leading self, and some articles mentioned in multiple ways. And so we wanted to make sure that we captured it. So what we did was we did a breakdown of all the different capabilities within the LEADS framework. And then we totaled it up. So it's not quite the right way to represent this, but we wanted to just show you that of all the different kinds of capabilities, if you look at all the capabilities, it's more prominent that leading self is there, engaging others is a little bit there. And then again, these three, achieving results, developing coalitions, and systems transformation are more evenly kind of like distributed in the literature. And for the LEADS Plus capabilities, what we found was that, as you can see, we kind of talked about how the followership was a little bit less mentioned, generally speaking. But that role-based leadership and complexity-based leadership make quite a bit of an appearance in the literature. Then the idea of that versatility and moving between wasn't mentioned as much as we thought it could be. And so this allows us to map the literature as we see it with the LEADS Plus framework to say, what are some opportunities for people to do some further research? And so, sorry for the frame shift here, but it looks like the idea would be that with the types of literature that are out there out of the 125 full text reviews, we did find that most of the types of literature out there are more descriptive and clarifying in terms of what they were, and other formats included conceptual pieces, kind of similar to the way we were talking about leadership, like thinking about the concepts and the theories behind it. And then there were a strong vein of papers that were really biographies of people, which is a different kind of storytelling that's interesting that we don't use a lot in medical education, but in the leadership literature, they actually have this subtype where it's at the end of someone's career, you might actually have a whole journal article about their career and have them reflect on their leadership journey, which we thought was quite interesting as we filter for papers on leadership journeys. And so that was interesting. And so, as you can see here, most of the kinds of papers that are out there were more conceptual and descriptive with a healthy dose of clarification studies. The biographies had a strong showing, but maybe justification studies, interviews, and systematic reviews were also less prominent in the types of literature that we saw that was relevant to leadership journey. And so all that to say is that our LEADS Plus framework sort of checked out in the literature, and there's room to grow in some of those aspects to be able to maybe shine a light on further elements of that LEADS Plus framework to do more empirical work, to maybe do some clarification or justification work, and that we could move towards that. And so I think my thoughts are that, as an education scientist, but also as an educator, I think there's room for us to then start taking these frameworks and say, okay, so if this is the conceptual framework for our curriculum, how do we manifest making sure that elements of this are within the curricula that we have for training leaders, for instance? Or how could we actually use this to scaffold the developmental journey of new faculty members in a new school of medicine? So these are the kind of things that we're pondering right now and thinking about how we could use some of these frameworks and theories and intercalate them into the work that we do. I think we can also fill the gaps, right? So we can figure out how we can add to the healthcare field in terms of leadership education, and maybe we can do more justification work to say, how do we justify that these things are worthwhile, like the return on investment, and that they have the outcomes that we want them to, right? And so if you do this as a mentorship program versus a course, right, which one has better outcomes, right? Or maybe it's both, and you need to actually figure out how you would test all of that. But I think there could be some more empirical work in that zone. And I think that we can explore new formats of scholarship as well, right? Noticing that there's so many biographical type stories. Like, are we missing that in our storytelling within medical education or health professions education? Maybe, right? I think having someone reflect about their own journey, it's almost like an autoethnography, but those are really hard to do. And so maybe a shorter version of that would be to have someone interview you about life's work so that we can understand the struggles behind it, so that, again, you can shine a light on the path that you walked so that other people can walk behind you. And I think that that might be something that we could all wrestle with as to whether or not there are new kinds of scholarship that we didn't know existed before that our scoping review might reveal. And so this is my new contact information if you want to get a hold of me. But I also have like 17 other emails. So and a bat signal sometimes works as well. So I'll just put it out there that happy to take questions or comments. And I know there are people so I'll open the chat as well. But I'm excited to have presented some of the scientific work that we've been working on as a team, and we hope that you might join us in taking this to the next step. Okay, we've got a couple of questions there. I think there's a microphone coming towards you.
Thank you so much, Teresa, for a fascinating presentation. There's a side note where I was like, did you do some of the animations yourself, like the drawing of the trees? But we can skip that.
Yes, that's a doodle. Yeah, it didn't
Beautiful.
make it in the paper. The reviewers did not like that paper.
Multi-talented.
Yeah.
Okay, the slide, just the slide just before this one, and I was fascinated about like thinking about other ways of knowing, other forms of knowledge.
Mhm.
And I was wondering about your thoughts about like concepts like epistemic justice,
Mhm.
and how do we recognize or essentially decolonize in the conceptualized way of like decentering whiteness within our own practices
Mhm.
that are very structured in terms of academia, like medicine as a starting point,
Mhm.
and then medicine plus medicine within the academy,
Mhm.
and how we have excluded historically, not just in terms of how we have pushed certain populations to the margins, but their knowledge too. And how do we do that and incorporate that into this scholarship?
Yeah, I mean, I think that me saying that there are new formats of scholarship, maybe they're not new formats of scholarship, but they're actually age-old traditional ways of scholarship that we traditionally haven't seen as scholarship. So you could see a storytelling by a wise person that's older. Many cultures have always seen that as a way to pass down knowledge and expertise and to shine a light on the path that was walked before, right? Definitely the Indigenous peoples of Canada, many groups use knowledge keepers and have elders who do exactly that. So I would say that the biography may be a manifestation of that we in our own ways have excluded, but maybe I'm calling out that we could be adopting them to allow for more of that transparency about how we actually engage in the act of leadership, right? I think that calling out the injustices of the past are also something that is important. And I think that that's where the, in the Leads Plus framework, really talking about that, that, that the fifth higher order kind of like Keegan's model of seeing multiple realities at once and yet also being a leader in that way, I think is a great way to think about how can you wrestle with the fact that you are part of the academy, you've been successful as a leader within the academy, and yet you can question the academy from the outside as a different identity center for yourself, and to see the win-win of bringing in Indigenous scholarship as, for instance, a way to manifest how we can do things differently. And so that's an example where our team has written into the clinical faculty policy at TMU Indigenous scholarship as a promotable activity and articulated how and what that means, right? So I think you can be both a leader that has maybe benefited from these structures and yet then turn around and make sure that we've paved the way for others to come from different paths, right? It's kind of thinking about it as you can get to the other side of the briarwood, but maybe when you go back in, you can take a different path and pave a different way. You can do a couple laps through the path, the forest, and lay down that that track for many other people. You don't have to only walk through that path once, and for your way to be the only way. I think you can acknowledge that other people may want to walk with you, and you can link their strengths with them, if that's the positionality that you have in the system. And for those of you who are on the other side of that, I think it's also important to acknowledge that reaching out to ask for help from allies and sponsors may also allow them to then take you under their kind of like power structures to help right some of those wrongs that would traditionally have marginalized you, but that you can have others that can speak up for you and alongside you to champion what it is that you're trying to do. So I think it kind of goes both ways in that way. So I hope that addressed your question. Okay.
My turn?
Yes, Renata, go ahead.
So I guess I was more curious about the question you kind of posed yourself, but
Mhm.
about how to use the LEADS framework
Mhm.
like transform systems. So I was wondering if you could answer that question with respect to your newish current role. But then the other part was I really liked how that framework was kind of non-hierarchical. It wasn't
Mhm.
like this person who's doing complexity-based leadership is inherently better than this person who's doing
Mhm.
fellowship, but people can move between roles
Mhm.
and that one is not necessarily better than another. They're just different things for different times.
Mhm.
So I kind of like that idea of like upsetting some very hierarchical organizations that we currently have.
Mhm.
So I was curious about how you've used the framework in practice and maybe specifically with respect to kind of maybe like undoing a bit of the hierarchy that exists in terms of the opportunities of your new role. Does
All
that all
right.
make sense?
Yes, both make sense. So the first question would be, it's a brand new framework, and I'm pitching it to all of you to help ask you to join in the cause and think through how it can be worked in. I have shared it with our curriculum developers, our health system science course lead, but again, trying to be non-hierarchical. I am not forcing anyone to use it, but rather saying, hey, this one that I happen to be an author on might be a article that has a framework that might be useful, but maybe not. It's up to you, right? And so I also want to acknowledge that people will come at it from different ways of seeing, knowing, and doing. And so want to make sure that we're inclusive in the way that they want to walk through it. But I do think that using it as like a journal club article or walking it through as we are trying to think through the complexities of some of these courses has been useful to me. And so there's the Bridging Leaders program that kind of helped co-start earlier on in the McMaster framework. It is built around the concepts that we were wrestling with at the time. We built the course at the time we were writing the Leads Plus framework. So it's not surprising that the Bridging Leaders framework really is around that duality of your role as both something and something else. And so we do talk about it in that course, and we've used it at least in that course to outline, okay, so you have two identities. When we talk about lead self, it's not self, it's selves. And so how do you reconcile the fact that you're a mom and a rock star scholar or not, right? How do you wrestle the fact that you are a emerge doc and you also have a 9 a.m. meeting, Jonathan, right? These are the things that we have to live with. And so I think helping people use the multiple identities framework as like a curricular organizing framework, I think has been useful in that way. So that would be my answer to the first question. Now, the second question is a little bit harder because the hierarchy is everywhere when you look, right? The way that we promote people, the way that there are, levels of promotion, the way that we have like, associate directors and the directors, there's remuneration differences and things like that. So I think that acknowledging that the reason why hierarchy sometimes exists is because it's an organizing structure and it allows people to have, hopefully, in the ideal setting, people who have walked their role before them in a role that's above them that can give them that mentorship and sponsorship and open doors and help them understand the role that they have so that they can someday take the baton and move up and subsume a new role, right? Now that's in the ideal setting, and we all know that nothing is ideal in the world, and so it can also be abused in different ways. But I do think that seeing it not so much as an oppressive feature, but a obligation for those who are in those more senior roles to look back and build better behind, I think is a way of actually maybe questioning that hierarchy, reframing it in a more service-oriented manner, and could unlock some of the way that we think about hierarchy and upend it in and of itself, right? If you saw that rather than climbing up, your job is to climb up and then make sure that everyone behind you can get a piece of the rope and climb up with you, that adds a different layer of obligation, I think, to the leadership role, and is something that I'm thinking about how to climb up and then send the rope down behind so that people can continue to climb, and so they have it easier, right? Because sometimes I think it's easy to get mired in the fact that you've arrived and then forget that there's a whole slew of people that would like to climb up behind you, and your job now as a leader is to make that slope a little bit less arduous to climb, right? And maybe get rid of the slope altogether by building an elevator. So I think that that's how I would frame my new opportunity, is that I am in a position where I do have this huge opportunity to build something differently. And so that's kind of like constantly the urgency that I have for our team, is to think through, okay, so could we make it easier? Does tenure promotion have to take a whole summer for you to do all the paperwork to be promoted? Right? Does it have to? Why does it have to? Or could it be different? And so that's an example of something that we're working on. We don't have any faculty to promote yet. That's a different issue. There's some paperwork that we need to figure out to get that done. We're close. And so the idea would now, as soon as we do have faculty, how would we make this more seamless, easy, and less of a burden, right? And so that service orientation as a leader is what I've charged people with kind of taking into their roles, for instance. So our the interim associate dean of clinical faculty relations really took that mantle and ran with it, to the point where it takes 10 minutes if you have your letter and CV ready. I mean, I think that that's a huge advancement from applications for other things. And so I think that's the kind of framing I think we can bring into some of these changes. Yeah, so that's kind of like where we're at. Thanks, Youngmin, for tuning in from Korea. Bye. It's a comment online. Mhm.
That was a great talk, as always, Teresa. Just someone who's kind of wearing a clinical hat, an academic hat, and then a national hat. One thing I find is that I'm wondering how the leaders framework actually works. If we, like, instead of a dichotomous role, I kind of find that perhaps if we identify what's similar to all these roles, goes back to the patient care aspect, and the patient is actually the center of what we all do, whether it be at an academic level, a clinical level, or a national society level, right? So I'm wondering how, like, not sure if it's a dichotomous role or actually a unifying role. You're just coming in from different perspectives. And so maybe you can comment on that, on how the Leads Plus works on that.
I mean, I think that depending on where you're coming from, it might be the patient that's at the center of it. But again, I think it's not always that clear cut, because I think sometimes the learners are at the center of some of the rules that you have. And ultimately, it's to drive healthcare, but you might have multiple roles that you have to reconcile, right? And you may have multiple stakeholders that you have to, and knowledge users that you need to make sure you tend to. And so I think that complexity is exactly what we're trying to wrestle with, is that you actually may need to hold multiple things in tension. How can you do something that's right for the patients and right for the trainees and right for your faculty? Because without one, the others can't thrive, right? And so I think that's where that fifth order of consciousness is about, actually standing in the middle of it all, looking for the pattern that rises between it all, and actually reconciling all three.
Yeah, I guess I was thinking more like, the trainees and the faculty and the healthcare providers and the students. The ultimate focus of the teaching of the health sciences professions is to ultimately to graduate you to look after the patient, right?
Mhm.
So I'm thinking if perhaps that's the middle portion. I understand that you have different aspects that come in
Yeah.
from training engagement but the learner might be a small center,
Yeah.
but the ultimate big center is the patient. So I'm just wondering
Yeah.
if that's a unifying thing that perhaps fits into this more of a complicated model of Leads Plus, which actually encompasses a lot.
Yeah,
more
I
than
think
leads.
it's a great place to start, but I would also say the reason why more and more frameworks, it started as the triple aim, then became the quadruple aim, and now the quintuple aim, because when we forget ourselves as people in a system, the system will churn you out, spit you out, and look for a replacement, and hopefully there will be one, but maybe there won't be, right? And so I do think that we have to hold in multiple tensions the multiple users within a system, and really look for frameworks that aren't so dichotomous or so unifying, knowing that you actually might need that duality or triality in order to really make sure that the system works for everyone in the system, right? So thinking about complexity science, and then design thinking, and some of these other newer ways of constructing the way that we see the world. I think some of them are decolonizing, because I think they really help us think through multiple vantage points at once. I do think that some of these technologies that people have brought in, and looking for maximal variation, really coming from that constructivist epistemology rather epistemology, sorry, rather than a hypothetical deductive one way or the other way kind of way of looking at, might be the solution to some of it, right? Because you can be 5 people at once right now in that chair. Why can't then you hold multiple realities in tension within yourself in order to find the multiple win condition in all those realities? Suddenly you feel like Doctor Strange in a Marvel universe where you're trying to thread everything together. But I do think that that's what we're talking about, is that acknowledgement that many of us in these complex roles exist in a multiverse, and that it's not going to be clear cut. And you could center on the patient, but then you might burn out your residents because they're working 1 and 2 call, or you might burn the bridge for your faculty who feel like they're not being seen or heard, and why would they want to work in an academic health science center? I'm just going to piece out into the community and hope they don't follow me there, right? And so I think we have to think through the realities of the choices we make as leaders. And I think that the multiple kind of like impressions that we have, they're giving us some kind of signal. And how do we put it all together? That's where we need to stand at the center of it and see the different kinds of leadership and the journeys that we can bring into that. All right, well, thank you very much, everyone.
Thank you for joining. For those online, thank you for being here. If you don't know much about Merit, you can find more about us at merit.mcmaster.ca. If there was elements of this presentation you want to share, you can share the edited version of Dr. Chan's talk, which will be online in our YouTube channel in about 1 month's time from now. So Teresa, so great to have you back. It's like you never left. Enjoy the rest of your evening. Bye-bye.